Hi, I'm Dr. Roadhouse, and I want to introduce you to my patient, Sally Ola. Sally was in our decompression program, um, and she had 5 herniated discs that we found on an MRI. She had one several years ago, was told she needed surgery. She had too many friends that didn't do well with surgery, so she waited. Then when she came to see us, we did an updated MRI and we found 5 herniated discs. So Sally, why don't you just let us know about how you're feeling, the pain, how it limited you, and how you're doing now.
Well, basically, I couldn't do much of anything. Everything I did hurt my back, and the pain stayed with me. And the doctors put me on all these, what are they? The anti-inflammatories, the muscle relaxants.
Did you get any cortisone shots?
Yes, I did.
Okay, all right.
And nothing helped.
Okay, all right.
And
it just progressively got worse.
And I wouldn't do surgery because everybody I know has had back or neck surgery has had to have more, and they're still in pain.
Okay. And you had sciatica. It was going down your leg, and it affected your sleep, and it really limited all your activities.
Yes, I was square dance, and I wasn't able to dance. And my house was a wreck because I couldn't run sweeper, I couldn't make beds, I couldn't do anything. Now, after decompression, I can do all that. Unfortunately, I don't want to put in the house. But
you had an excuse before.
I have an excuse.
Not
I have
anymore.
none now, and it really, can't say I'm never without pain.
Right.
But when I do something I shouldn't do, it doesn't last.
Yeah. So you still have some trouble every once in a while. Mostly we talked about that's the muscle because you've been so inactive for years. But before, when you did something, first of all, you couldn't do a lot of things. But when you did, it really flared it up and it stayed with you all the time. And now when you do some of these activities, your back gets a little sore. You might have some pain, but then in a day or two, it's gone.
Well, usually after I go to bed and sleep, I get up the next morning and it's gone.
Yeah, so that's more of the muscle soreness, and that's why we've given you the back exercise. So since the decompression, you're feeling great. You don't have the sciatica anymore, and you're back square dancing.
Yes.
And you're cleaning your house, right?
Yes.
Good. So is there anything else? I know that when someone has a problem like this, that they tend to have amnesia, as far as how bad the pain was and stuff. But I mean, obviously, your husband was aware, of the pain that you're in because there was a lot of things that you couldn't do. I mean, you couldn't go out to eat, because your back would hurt. It'd be hard for you to sit there. Anything that included sitting, any kind of social event, stuff like that, you had a hard time standing.
Yeah, we quit going to movies because I couldn't sit long enough. And even when I was working on a degree and I was in college classes, I would have to get up in the middle of the class and stand up.
And how about now when you're sitting?
Doesn't bother me. I can sit all day long. Okay,
good. All right. Well, this is just another example of how the decompression works fantastic, and so that if you know anybody that's having any trouble, because Sally really didn't know about the decompression when we talked about it. She didn't even know what it was or that it could help her, and this is the answer to her problem. It's given her life back. So I appreciate it.
And I would recommend it to anybody that is thinking about having surgery.
Well, thank you very much.